From KETK, you're watching East Texas Live.
Welcome back. It's Medical Monday, and September is Prostate Cancer Awareness Month. And today we're joined by Dr. Stephen, a urological surgeon, to talk about prostate cancer and one of the most common cancers among men. Thank you so much for being here today.
I really appreciate it. It's an honor to be here.
Yes, sir. So can you tell us a little bit of some of the basics of prostate cancer?
Sure. So prostate cancer is one of the most common cancers that affects men. It's actually the second most common cancer that affects men in our world, and 1 in 8 men will get it in their lifetime, and so it's a very important thing to talk about.
Yes, sir. And so who's most at risk of getting this?
So all men, as we age, are at higher risk of getting prostate cancer. So we typically will tell men that it's important for them to discuss this with their doctor and ensure they're getting screened for it. But men who are older in age are at higher risk of getting it, and then men especially who have a family history of prostate cancer in a brother or a father.
Yes, sir. And so what are some of the symptoms men should look out for?
So that's kind of the biggest problem, is unfortunately there is no symptoms. And so men don't realize that they have anything going on. And so it's very important for them to get screened for it with a simple blood test. And that way we can hopefully catch it very early.
Yes, sir. And so if someone was diagnosed, what are some of the treatment options?
So when it comes to prostate cancer, the good news is if we do catch it early and it's a very low-grade cancer, sometimes we can just watch it with an active surveillance protocol. And that allows us to stay on top of it but limit the side effects from some of the treatments. However, if we catch it and we realize that it is severe enough that we need to treat the prostate cancer, then that often includes things like robotic prostatectomy, which is a removal of the prostate, or sometimes radiation and hormone therapy.
Yes, sir. How do some men go about talking to their doctors about this?
So when it comes to the screening, it can be done just with your primary care physician, and so that's what's really advantageous about this is, again, it's a simple blood test. You can go in and talk with your primary care doctor when you see them once a year or every 6 months and ask about it. And for most men, we recommend that they do that starting at around the age of 50. However, if you have a family history, you should start doing that around the age of 40 or 45, and that's, again, just getting a blood test. And so talking to your primary care physician is where I would recommend that they start.
Yes, sir. And how often do the men need to be checking their prostate?
So at least once a year is the recommendation, and then obviously if there's anything abnormal with it, you would typically come see a specialist like myself, a urologist, who would be able to kind of determine if other tests needed to be done, such as an MRI of the prostate or some of these other things that we can do now.
Yes, sir. And what's the main takeaway you would like men to take from this?
So the main takeaway is make sure you get screened early, and talk to your primary care physician about this important health issue.
Yes, sir. Where can men get more information about this?
So if you go to our website at UT Health, and you go to the urology page, there's information about the prostate cancer, and we'd be happy to get you plugged into either a primary care physician through our facility or with us in urology.
Yes, sir. Well, thank you so much for coming in.
You're welcome. Thank you so much. Appreciate your time.
Yes, sir. For more information, go to the website right there on your screen.